leading cause of school absenteeism for children due to illness. You and your team already play an important role in coordinating services and provide education to the parents. Can you briefly talk about how you coordinate these efforts?
Absolutely. Thank you first for allowing us to come. And let me just tell you a little bit, the audience, a little bit about Fulton County School System, because sometimes it's confusing with two school systems in Fulton County. So Fulton County School System are all the schools outside of the city of Atlanta. So we have 106 schools and we have an enrollment of about 96,000 kids. So I have a team of 20 registered nurses. And then in all of our schools, we have a school-based clinic where we have a healthcare provider, kind of like a medical provider, but it's a medical assistant. My registered nurses oversee the medical assistants in the schools. So with that, what our team does is, and you said it exactly right, we play an extremely important role in the lives of children with asthma. And why? Because if you think about it, kids spend 8 hours of their day, 5 days a week out of 7 days in school. So what we bring to the table is extremely important, and we take that role very, very seriously. So what we do is we first of all make sure, and you've heard some of the panelists already talk about action plans. That's the first thing that we ensure that all of our children with asthma have, is an action plan on file in school. But we don't just keep it in a file. That becomes a living document that we use every day to make sure that kids receive the proper care that they need if they have asthma during our school hours. So with that plan, we actually review every plan. We make sure that kids, according to that plan, have the proper medication, supplies that they need. We also do, talking about education, kids come in the clinic every day to get their medications. So it's a wonderful opportunity for our team of nurses to spend with children going over medication. How do you use your inhaler? And some of the kids say, I know, but we always say, but we want to see you. Let us see you. We need you to be in our sight. So that, again, there's that opportunity for continued education. We also work with the partners in the community, the providers. We make sure, talking about relationships, that we build those relationships with our community providers. Because our goal is also to try to help kids stay out of the emergency room. So if there are children that we see that don't seem to be well controlled, my nurses are making phone calls to those kids' providers. But one of the gaps that we talked about is exactly that, the access that some of our kids have to a provider or a medical home. So again, that's where the school nurses come in, because we're trying to help parents find kids medical homes so that their care can be standardized.
Great, thank you. If you note on your table, you see the pink slips. Those are the index cards for you to ask questions. In the interest of time, we won't have people asking questions, but if you can jot down your questions, one of my team members can collect from you and we can pick a few questions. But we'll make sure all these questions are answered when we do send a follow-up email. Okay, thanks. So Margarita, you are more involved in the technology aspect of healthcare system, the IT. Is there a place for innovation? How do we capture outcomes? A patient comes, grabs medication, then he goes to another clinic, grabs medication. There's multiple tentacles working in different directions. How do we track patients in the real world? How do we know their outcomes are improving? It's a humongous task, right? Can you tell us how your department is working in these terms to improve the standards of tracking patients' outcomes?
Okay, well, thank you for the question and thank you for the opportunity. Is this on? Okay, thank you. Sorry. Okay, very important question. So a couple of things, and actually you touched on it just a minute ago. There's a lot of innovation. There's a lot of systems. The problem is they don't speak to each other. And so there's a lack of integration in information systems. Part of that, and I have to say, I'm not actually a technologist. I'm a social scientist by training. I just manage a group of technologists over at Tech. So we've got some really smart people working on this. The challenge is that a lot of these information systems belong to different vendors. And so the output of those information systems, whether it's the EMR, the electronic medical record, the electronic health record, the personal health record, all these things, the information that goes in is sometimes it's unstructured data, sometimes it is structured, which means that it's field, there's a way to get it in, there's a way to get it out, and these systems are not always compatible. Okay, so I'm kind of explaining it in layman's terms. That's a problem. So you actually touched on the word standard, information standards. That's something that is being taken on at the federal government with the ONC and CMS, Medicaid. I was actually at a really large health information technology conference in February. And I was sitting in one of the sessions and the guy said, this is not your grandfather's Medicaid agency. Like what they're proposing and what they're pushing and the types of projects and initiatives that they're funding are really innovative. The challenge is, again, when all these different providers who are not technologists, you went to medical school to be a doctor, okay? So when a vendor comes in and sells you a solution, they promise you the sky. And then sometimes the solution doesn't deliver, or it does within your four walls, but not talking to the hospital system. So then comes the need for regional exchanges, service area HIEs, that sort of thing. In Georgia, some of you may know, there is a statewide health information network. My team was actually a part of, I'm the program manager, by the way, for the work that we do with the state of Georgia, the Department of Community Health. Along with, we work very closely with Children's Healthcare of Atlanta. So one of the things in terms of tracking outcomes and all that, if you can work with a partner, like for us as technologists, we don't have data that just sits around at Georgia Tech, okay, because we don't have medical school. But we're very blessed to have some really good partners, such as Children's Healthcare of Atlanta, some other physicians here, like outside of Atlanta. So if we can work with them, there's also the need for analytics, so informatics, and you touched on that as well. We can do that, but it's just on that data. There's the issue of marrying claims data, okay, so like Medicaid data or data that Blue Cross Blue Shield has, and then marrying that with clinical data that sits in the doctor's office. Like, that's part of, it's not really been done. And we are all trying to tackle that at state levels, and we're at different levels. And Georgia, we're making progress, but there are other states that have really made some more advancements in that area.
Great.
So it's not just about asthma. I think generally speaking for chronic diseases, this is a challenge.
Great. Christina, research. Health impact of asthma and regional pollutants. You've taken up some of those research yourself and conducted the environmental challenges outside of school, and how does that affect the normal breathing for children? There are still many gaps in knowledge and areas where research is needed. How do we identify the areas that gives the most impact?
Well, first of all, I want to thank you very much for inviting me to come here and speak, and I'm very pleased with the range of expertise that we have here so that we can really engage in these questions. And so I think first of really figuring out what the areas are for research is to really talk to the community first, because they have the most information about what the actual problems are and can help to generate research and research designs that we can get to those questions and then begin to figure out, based on what the research shows, of interventions that can work. And so the majority of my research has been looking at exposure assessments, so that's figuring out where and how much people are exposed to different kinds of pollutants in outdoor and indoor environments. And that feeds into also what you were just talking about, Marguerite, in terms of data and where data is coming from in order to really do these epidemiological studies. Because actually there's some good information that's in your packets here about indoor triggers and also about epidemiology and how we know that air pollution is linked to asthma. It's definitely linked to, there's a lot of support for air pollution from outdoors, especially when we think of particulate matter and ozone being linked to asthma attacks. And there's also evidence showing that it's linked to development of asthma in the first place. So what I think is important is that this information has come from very large-scale studies of lots of children over time and repeated measures on children and following them over time. So I think it's very important for us to try and have linkages of children in different areas and to follow them over time to really be able to understand about development and also on triggers as well. Because we have to think about that there's lots of different triggers in the indoor environment. There's allergens, there's mold, there's pollution indoors, and then also outdoors. And the triggers for a particular child are different. And in terms of asthma action planning, they need to know what are the triggers for my child. And in research, we want to be able to look at the range of that and then how we can prevent those.
Great. Sandra Jones, I came to you on purpose asking you this question to you in the last, because after all is said and done, it boils down to the person living with asthma. We're all health illiterate at some point at certain stage. So you can imagine a person visiting a physician, going home, taking the prescription, had no idea when the doctor said eat it 3 times a day after food. Does he eat it all at once or after every meal, right? He takes the prescription home, has all these stresses going on, kids, wife, husband, job, places the prescription somewhere else. It's all about health literacy. How can you tell the audience here how important health literacy is in relation to asthma, and what are some recommendations regarding health literacy for healthcare organizations and even healthcare providers with different cultural contexts, language barriers? How do you connect those mismatches in a perfect storm?
Wow. Thank you, first of all, for this opportunity. Let me just kind of set the stage here, or the picture around literacy in this country. There's a National Assessment of Adult Literacy, and they do a sample size in this country of about 19,000 individuals from ages 16 to 60. And the purpose of that is to get an idea about the literacy of the Americans. And they also measure health literacy. They do this about every 5 to 10 years. And one of the things that they found is that about 78 or 90 million people in this country are challenged with health literacy. Now, what does that boil down to? Well, you've got about 1 in 5 adults read at about a 5th grade level. You've got, or below. You know, on average, American reads at about the 8th or 9th grade level. And yet most health materials are written at about 10th grade level or above. Now let's just bracket that for adults. If you take children and adolescents, literacy with that age group is just in its infancy. But if you look at the national report card around adolescents in this country, about 26% of them read at about the 5th grade level. So you factor in that most asthma kids missed an extra 1 to 3 days beyond the normal kids. I don't want to say normal, but kids who do not have asthma. So you've got a nice pot of stew there for families, for providers, for pharmacists, for school nurses, for anyone who are in constant contact with kids and adults who are trying to manage their asthma. You know, if you look at a lot of the health materials, and it has great intentions of trying to help families manage their asthma. But if you're struggling, and I volunteer and teach adults how to read, there are many people in this country who drop out of school at 3rd grade, and they can't read. And you're not going to find too many people, at least in my experience, because there's a lot of shame there. Or there's an assumption that because Sandra, and by the way, I have a daughter who has asthma, she's 30 years old, the assumption is that by the fact that they're coming to the healthcare system all the time, they know what to do. They know how to manage their asthma. But it takes a lot of courage and a lot of humility to say, I don't understand, I don't get it, I've tried everything I possibly can. So what can we do? There are tons of efforts nationally that are going on. Number one, the Institute of Medicine has identified 10 attributes that a healthcare organization can have that starts the conversation that can bring about changes in operations around health literacy. One of them is to look at their policies. Another one is to look at their materials, professional development for their staff. You want to put it on the radar for them to be aware and cognizant of the fact that we are seeing patients with chronic illnesses. Are we doing everything we possibly can to improve their health outcomes? And by the way, literacy is probably one of the most strongest predictor of health outcome. Beyond race, beyond economics, beyond culture, okay, literacy. There is a national action plan put out by the Department of Health and Human Services, and they identify strategies, goals that organizations can do to address health literacy. The last thing I want to say to you is this, that according to the Center for Healthcare Statistics, a disproportionate number of minorities and immigrants are estimated to have literacy problems. 50% of Hispanics, 40% of blacks, 33% of Asians. So just think about that as you think about the clients that you're serving and seeing in the emergency room, in school-based clinics, in the classroom. And you might say, and then I'll stop, well, the teachers are there. They can provide health education to the students. Well, that may be true, but there are studies to suggest that there is a variation between addressing health topics in Minnesota and Georgia, or New York, or Iowa. The standards are there, but the implementation of them varies tremendously.
Great.